We treat sleep like a biological reset button. You lie down, the system powers off, and the body repairs itself. But inside your arteries, the middle of the night is anything but peaceful. This timeline charts cardiovascular mortality across a standard 24-hour cycle. Notice this concentrated spike right here. Between 2 a.m. and 6 a.m., the human body reaches its highest statistical vulnerability for fatal heart attacks and strokes. Common internet advice often blames simple mechanics for this, claiming that rolling onto your left side or sleeping flat on your back puts fatal stress on the heart. The clinical data does not support this. Early morning cardiovascular failure isn't a random accident of timing. It's the climax of a physiological chain reaction that begins hours before your head hits the pillow. For those over 60, survival during the 4 hours after falling asleep is dictated by how you manage the 4 hours before going to bed. The countdown begins at 7 p.m. with physical inertia. Most of us spend our evenings sitting still, watching television or reading as we wind down from the day. The American Heart Association tracked over 8,000 adults and found that this uninterrupted sitting causes blood to pool in the lower extremities. This stagnation slows your systemic circulation to a crawl. When we follow this inactivity with a late-night snack, we introduce the next variable, nocturnal hypertension triggered by sodium. This chart compares nighttime blood pressure levels. Normally, blood pressure follows this plunging curve, a healthy nighttime dip. But late-night sodium acts as a rigid floor. It keeps your pressure high, resulting in a 3.2 times higher incidence of early morning cardiovascular events. These early evening habits prime the vascular system for pressure spikes at the exact moment the body is trying to power down for repair. By 9 p.m., the focus shifts from physical habits to the chemical substances ingested just before bed. The European Journal of Preventive Cardiology recently studied the synergy of combining common sleep aids with regular alcohol consumption. Combining sleep aids with alcohol creates severe respiratory depression. As these rhythm waves lose amplitude, cardiovascular mortality jumps 73%. Adding common allergy medications creates a hidden chemical load that suppresses these waves completely, triggering sudden cardiac death. In an attempt to force sleep, these chemical combinations depress the central nervous system so heavily they push the heart to the brink of collapse. At 11 p.m., the final moments before sleep, the biological threats can be dismantled with scientific countermeasures. The American Journal of Epidemiology highlights the importance of pre-sleep hydration. As you sleep, you exhale moisture, causing your blood to thicken. The glass of water at bedtime dilutes the blood, preventing that dangerous nighttime thickening and restoring smooth flow. The most powerful intervention for the 2 a.m. danger zone comes from the Hygeia chronotherapy trial. The trial found that simply moving the exact same dose of blood pressure medication from the morning to bedtime reduces the risk of cardiovascular death by 66%. These 11 p.m. interventions act as physiological shields designed to absorb the incoming cardiovascular shock at 2 a.m. Bedtime is not a passive off switch for the body. It is an active, highly sensitive medical window. This is the science of chronotherapy, the practice of matching your habits and medication to your body's circadian rhythms. The 2 a.m. to 6 a.m. danger zone is a physiological vulnerability that responds to behavioral changes. It is not an inevitable consequence of aging. You secure the system by hydrating against blood viscosity, avoiding late-night sodium, breaking physical inertia, and timing medications to the biological clock. Mastering your evening timeline diffuses the body's most dangerous biological time bomb, ensuring you wake up safely on the other side.